Hello, my name is Stephen Campbell. I'm a Professor of Primary Care Research here at the University of Manchester. I've worked here since 1993 and my particular focus is on quality of primary care and the safety of primary care, with a particular focus on general practice. In addition to working at the University of Manchester, I've worked in Germany, the Netherlands, Australia and done some work in the USA. I teach the primary healthcare module of the MPH, which is an optional module, and I've been doing so since 2007. Now, I have a passion for primary care and a passion for primary healthcare and general practice. The evidence base is very clear. Those countries with a better, more orientated, more integrated primary healthcare system within the healthcare system of that country have better health outcomes, better experiences for patients. And it's important that look at the primary healthcare from a different context and different countries' perspectives. The way in which healthcare systems develop and primary care systems develop will differ according to history, political, geographical, financial, all sorts of different issues. So the purpose of the course is to say, okay, what is primary care and primary healthcare? What is the evidence base for it? What are the definitions and the concepts? But then equally, how do you apply that to different countries? So in the past we've had all sorts of countries from Africa, Nigeria, Uganda, Kenya. We've had many countries from the Middle East, Russia, Poland, Australia, the USA, and quite a lot of people select the UK, for example. So the way in which the course works is we will go through 2 units of concept and the history of primary care and the definitions of primary care and how they apply generally, with particular focus on the World Health Organization and the difference between primary healthcare and primary care. And then we'll start to say, okay, but how does that apply in different contexts and different settings? So we look at sub-Saharan Africa and how those things might change, and then we look at the models of primary care, how the structural delivery of primary care, the workforce, and then how you might seek to evaluate primary healthcare across 3 weeks at the end of the course. What's important is that we have the general concepts, but each individual student applies their learning to their selected country, and that's the cornerstone and hub of the ethos of the module. So, who's it for? The pathway is part of an optional course for the MPH. It's integral to the MRes primary care, but it's also important for people who have an interest in primary care or who have a learning for primary care or work within primary care and want to apply the concepts and definitions of primary healthcare to their workplace and to their environment. So it's suitable for all sorts of public health specialists, practice managers, nurses, GPs and healthcare managers across the world. Whilst we have a particular focus, or I do, on the UK, the important thing is to apply these issues to the country which you're in and which you want to apply your learning. So, how do we assess it? We do the normal midterm and final assignments, but we also have 2 marked discussion boards, which account for 5% each of the overall mark. I try to make the course as interactive as possible, so we have 3 online seminars, which are optional, which you can take part in, so we discuss progress as we go along. The aim of the marked discussion boards is to try and give feedback to work towards the midterm and final assignments. We also, or I try and do as many podcasts as possible, particularly at the end of a topic, so that I can outline the key factors. So, primary healthcare is the most important part of a healthcare system. The important thing is to understand the general concepts, but then fundamentally how you apply that to your selected country. And that is the cornerstone of this course.